Hi, my name is Jessica Barker. I am a student at Purdue University Global. Today I'm going to be performing an abdominal assessment on my daughter. I'm going to be doing a cranial nerve assessment, and I'm also going to be checking muscle tone in a muscle assessment. I will be using the steps nursing process to complete this inspection. Faith, my name is Jessica. Can I please perform an assessment on you? Start with an introduction. So the patient said yes. The first step in any type of assessment is inspection. So I'm going to start off by asking the patient to lift her shirt up to her breast and just expose down to her hip. So while I'm here, I'm starting off with inspection. I'm not going to touch anything until we go into percussion. So I'm inspecting for tone, for symmetry, for any abnormalities like distension, anything brutally noticeable. So here I can see some pulsations of the aorta, which is fine. That's a normal finding. And you can sometimes see the peristaltic waves as well. That is also normal. So I'm going to go ahead and move right into auscultation. There are 4 quadrants you must auscultate. You should hear between 5 and 30 abdominal sounds a minute. It'll sound like some gurgling sounds. So I'm doing right upper, left upper, left lower, and right lower. While I have the stethoscope in my hand, I'm going to go ahead and listen to the aorta. Check for any bruits. Here. I'm going to go ahead and check the iliac arteries. Again, listening for any type of bruits. The renal. And then we're going to go ahead and check the femoral arteries. And since I have it in my hand, let's check for some splenic rubs and some hepatic rubs, which are all negative in her findings, so that's all normal. We're going to move on to percussion. Percussion is a technique where you use 2 of your fingers and kind of assess for the sounds of the abdomen. So you're going to hit your fingers and bounce back. You don't want to keep your finger over it because it will dull the sounds. Now in the abdomen, it's primarily air. So the sounds should be tympanic, which they are. If I do it over the rib, you hear a harder dull sound. That's because I'm over a structure. So under the left-hand side, you're going to find where the spleen is. Her spleen can't be percussed right now, and neither can her liver. So I'm going to go ahead and move into what we call light palpation. This not only gets the patient comfortable with touch, but I can also assess for some tenderness as well. Can you let me know if there's any pain in your stomach, please? Mm-hmm. Okay, so now I'm going to move into a technique called deep palpation. This is where we're really going to try to assess for any splenic borders. I cannot feel her spleen, which is actually a normal finding. I'm going to palpate for her liver, which I cannot feel the border of her liver, so I'm going to have her take a deep breath in. And now I can actually feel the very, very tip of her liver. You can use a technique called cuffing, which I'm going to stand up and show you. If you cuff your hand like a C, have her take a deep breath in, go up and around the rib cage, and you can actually feel the liver border that way as well. You can use the technique of percussion to find where the liver starting point is in between the intercostal spaces. See how the sound went to dull? So hers is probably about a good 4 centimeters is what I'm measuring, which is normal. 4 to 7 centimeters is normal findings. While I'm here, I might as well just go ahead and find out how big her aorta is measuring as well. Again, you want to find the palpation. You can kind of feel. Hers looks like it's between probably about 2 centimeters, which is a normal finding. So now that we have percussed and palpated the liver and spleen, I'm going to go ahead and call this a normal abdominal assessment. But if someone was to come in with abdominal pain, there's a couple tests that you can do to check for peritoneal inflammation. One of them is just rebound tenderness. So if you take your fingers, right hand side, push down, take an inspiration, and then release. Did it hurt worse when I pushed down or released?
Push down.
So that is a normal find-in. If someone had peritoneal inflammation, they could have rebound tenderness, and once you release, the pain would be worse. There's also a sign called Murphy's sign, which checks for cholelithiasis. So if you were to go on the right-hand side, you push down, you have them take a really deep breath, and let go. So she was able to breathe normally. If she had cessation, if she just stopped the inspiration, that's a positive Murphy sign. That would be a sign of like a cholelithiasis. So the other sign I'm going to teach you is called the Rosen sign. If you go on the other side of the abdomen, so the left side of the abdomen, push down. Did you get any pain in the right hand side at all?
No.
If she had pain in the right hand side, that would be a positive Rosen sign. That's a sign for peritoneal inflammation. So we have done the Murphy sign. We checked for rebound tenderness. We've done Rosen. I'm going to now do Psias sign. So I'm going to have her move her right leg up against resistance. You can tell she's done this before. Any pain?
Mm-mm.
Okay. And I'm going to do this as well. Any pain?
No.
While we're here, we might as well move into the arbitrary sign. Again, these are all signs for peritoneal inflammation. Any pain when I rotate?
No.
Belly. Any pain?
No.
So those are all negative findings, so she has no signs of peritoneal inflammation. I'm going to have her sit and face that wall, because I'm also going to show you what else we can assess for abdominal assessment, is CVA tenderness. So, okay, percussive kidneys too, but any pain?
No.
So she has no CVA tenderness, so I'm going to consider her abdominal assessment with benign findings. She has a normal abdominal assessment. We're going to move right into your cranial nerves. Is it okay if I test your cranial nerves?
Yes.
I'm going to ask you to do a bunch of funny things, but I'm going to ask you to face the camera. So, there's 12 cranial nerves. We're going to start off with the first one. The first one is called olfactory. So for this, I'm going to have the patient close her eyes. You can have them do one nostril at a time. I'm just going to go ahead and have her do both. Could you please take a smell of what I'm holding and let me know what I am holding? What scent, what smell do you smell?
Vanilla.
Very good. So it has your tie of vanilla essential oils in my hands. You really don't want to use anything that's awful smelling because it could initiate a gag reflex and the patient will come back and see you. So next we're going to check for confrontation and visual acuity. So this is cranial nerve 2, and we're going to check your periphery. So I'm going to ask you to stand facing me. I'm going to ask you to cover your left eye, and I'm going to cover my right eye. So you're going to check her periphery. So stare right at my nose or my eye, and let me know how many fingers I hold up.
2. 3.
You're going to be about arm's length away.
2.
Very good. So now, other eye, same thing.
2. 3. 2.
Good. So her periphery is intact. For the next one, visual acuity, we're going to use a Snellen chart. Now, I don't have 20 feet to work with, but additionally, realistically, you should have the patient stand 20 feet away. I'm going to have her close one eye. I'm going to have her close the other eye, test it, and then we're going to test both of her eyes together. So this is the Snellen chart. Could you please close one of your eyes and read from the furthest line down that you can?
P-F-O-D-T-E-L.
Okay, close the other eye.
P-F-O-D-T-E-L.
Okay, and then I'm going to have you open both of them and read from the line.
P-F-O-D-T-E-L.
Alright, so the patient has, according to this, 20/16 vision. Of course, we weren't 20 feet apart, so not 100% accurate, but I want you to get the idea of how to test for visual acuity. You can go ahead and have a seat again. We're going to check for cranial nerve number 3, ocular motor. I have a pen like this somewhere. So ocular motor, we're going to check for nystagmus, okay? Nystagmus is involuntary movement of the eye. It's when it jitters back and forth. That would be an abnormal finding. So I'm also going to check your cardinal phales, and we'll go from there, okay? Mm-hmm. Alright, so we're going to check your muscle function in your eyes. I want you to follow my finger, okay? Again, all 6 cardinal phales. I'm not noticing any nystagmus. Let's go ahead and do confrontation. And I'm doing cranial nerve 3, 4, and 6. So it's just easier to do them all together. We're skipping number 5 for right now. So the other responses, I'm checking for pupillary reflex. This is where the term perla comes in to term. So as she sees the light, I'm going to flash it in from the side. This eye should constrict as well as this pupil. So right now they're about 3 millimeters. I want you to stare at my nose. I'm trying to show you what I'm doing as well. The room ideally should be darker, but for the purpose of the video, this is why it's so light. Okay, ready? And her eye does constrict to about 1 millimeter. That's normal. And they both are constricted. And then I want you to follow my finger. And her eyes should cross, which they do. So your cranial nerve 3, which is ocular motor, and then 4, which is trochlear. That's the one that we did the cardinal veils. And then you have the abducens, which is cranial nerve 6, which tested for your side movements of your eyes, or the lateral rectus muscles that we tested. Those are all intact. So cranial nerve 5, we had skipped. That one is in charge of the mastication of the jaw. So I'm going to go ahead. There's a couple muscles you can feel here. But I'm going to have her open her jaw against resistance, which she can do easily. So cranial nerve 5 is also intact. We're going to jump to number 7 because we've already did number 6. Number 7 is the facial nerve, so I'm going to have her do a bunch of funny things. So can you please smile for me? Make a frown face. Like a sad face. Yep, a sad face. Very good. I want you to lift your eyebrows, puff your cheeks, and give me a big smile. So cranial nerve 7, which is facial, is also intact. We're going to move on to number 8, which is the vestibular cochlear nerve, which is in charge of, like, I'm going to do a whisper test. So I'm going to occlude this side of her ear, and I'm going to say something way over here and make sure she can make out what I'm saying. We'll just do something basic.
It's summer.
Very good.
I love dogs.
So she can hear me just fine. So cranial nerve 8 is also intact. We are going to move on to number 9. Number 9 is the glossopharyngeal nerve. Nobody seems to like this one. So the first one is we're going to have the patient say ah and make sure her uvula bounces up. And then I'm going to initiate a gag reflex. This is not fun. Okay, ready? Stick your tongue out and say ah.
Ah.
So her uvula did move up. That's initiated. And that's a gag reflex. So those are also intact. Number 10 is the vagus nerve, which is responsible for talking, for swallowing. So I'm going to go ahead and have the patient swallow. And she swallows, it's symmetrical. She's talking, there's no hoarseness, so that nerve is intact. That one's pretty easy to do. Number 11 is the accessory. This one has to do with, like, your head movements. So I'm going to have you move your head up, down, side to side. And then you can have the patient shrug their shoulders, which she does. And then number 12, I'm just going to have you stick out your tongue. Midline, she can stick out her tongue. All her cranial nerves are intact. We're going to move on to her motor assessment. So I'm going to start with orientation. Could you please tell me your name and date of birth?
Faith 05/26/2010.
Okay, where are you?
My house.
What's today's date?
The 22nd of July.
And what year?
2022.
Okay, what are we doing today?
Camping.
No, what are we doing? Right
An assessment.
Okay, very good. So the first thing we're going to do is start off with the inspection. Here we're just testing. We're going to look at her for muscle tone, any type of atrophy, symmetry. Okay, I'm going to have her close her eyes, and I'm going to ask you to tell me I'm trying to see if you can tell the difference between sharp and soft. So I actually have a Q-tip, soft end, sharp end. Alright, so I'm going to touch different parts of your body, and I want you to tell me if it's sharp or soft.
Soft. Sharp.
Okay?
Soft. 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 Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp.
Okay, and then I want you to tell me if something is cold or hot. Okay? Ready?
Cold. Hot. Cold. Cold. Hot. Cold. Cold. Hot. Cold.
So she can tell the different sensations between sharp and soft and cold and hot. Alright, so I'm going to move on to her neck, and I want to make sure all of her muscles can basically meet me with equal strength and resistance. So I'm going to have you try to move your head back. Very good. Now try to move it forward, like look down. Very good. To the side. Other side. Good. Why don't you shrug your shoulders? Try to lift me up. Very good. Why don't you lift your arms up? Okay. Try to lift me off the ground. Very good. Bend your arms. Big muscles.
Oh, wait, what?
Muscles. Muscles.
Oh.
Lift them up. Good. Bring them forward. Try to move me away. Try to pull me forward. Very good. How about you lift your legs up? Good. Down. Very good. I want you to cross your arms. Try to see if you can get off without using your arms. Good. Down. Very good. Well, she's here. I'm also going to check her movement and her tone. So keep you move your wrists for me. Move your neck for me. Arms. Range of motion. Okay, can you move your ankles? Other ankle. Very good. Let's assess her gait as well. Can I have you stand? Can you walk to that room and back, please? And make sure she can walk without any instability. Okay. Can you close your eyes and stand on one foot? Good. Other one. Oh, that's right. Let's try this again.
Okay.
Good. Good. Now can you bend over and touch your toes? Bend over and touch your toes. Yep. I'm also going to check for her spine as we're here. Good. Can you have a seat again? I'm going to check some deep tendon reflexes as well. Alright. I'm going to check some reflexes, so I'm going to be banging away at some of your muscles here, okay? So we're going to start in the wrist with the brachial radialis. I'm going to have you relax completely. And again, I want you to focus on the muscle that's reflexing, okay? So that's a positive. Not really where you're like hidden, like I don't want to know about this, I want to know about the actual one that we're testing, which hers initiated quite well. We're going to check for the brachial. So you're going to put your hand in here. You're actually going to hit my thumb, and I want to see the reflex, which it initiated. Relax. Good. Triceps, I'm going to have her kind of hold her arm this way. Relax. There we go. Good. Let's do it. Can you move back to your knee a little bit? I'm going to try to have that dangle a bit so we can relax it. I need you to come a little bit forward. This is the patella. Good. Let relax it. Good. And then we're also going to do the ankle. Relax. Good. Relax. Good. So all of her deep tendon reflexes are intact. I'm hoping we didn't miss anything. So I've done a complete abdominal assessment on you. I've checked cranial nerves 1 through 12 on you. We've gone through all your muscles. We've checked for gait and stability. We've checked for sensation, muscle tone. I think that concludes our assessment. Thank you very much, and thank you for allowing me to do my assessment on you.